What is a jammed finger? So a jammed finger is actually not a diagnosis. It explains the mechanism for how a finger gets injured. A jammed finger is when you sustain an impact to the tip of the finger. A fast-moving basketball hitting the tip of your finger, or moving into another person or player on a team, causing a force to hit the tip of your finger. There isn't just one kind of jammed finger. There are lots of different injuries that can happen when you have a jammed finger. You don't necessarily know what the injury is just by saying that you had a jammed finger. The finger has many parts, so a lot of different things can be injured when you have a jammed finger. The type of injury you get depends on how big the force is, the angle that it hits the tip of the finger, and the position the joints of the finger are in when that injury occurs. Three main types of injuries that can happen. One is injury to ligament, the other is injury to tendon, and then the third is injury to bone. Ligaments are structures that connect bone to bone, and they provide stability to a joint and prevent the joint from bending or moving in a direction that it's not meant to go. Tendons are like little ropes that connect the muscle to the bone. So muscle is like the motor, creates the power, and the tendon is like the transmission. The force from the muscle is transmitted through the tendon and into the bone. Bones provide most of the structural integrity of the finger. There are 3 bones in the finger and 2 in the thumb, 3 joints in the finger and 2 in the thumb. A bone in the finger is called a phalanx. Injuries to ligaments can be mild. Those can be anything from a few micro tears to a ligament, and we call that a mild sprain, all the way to complete tear of a ligament. Complete disruption of ligaments can cause a dislocation of the joint. Injuries to tendons can cause a sudden loss of motion. Tendons can tear, like a rope, or they can also detach from the bone itself where they're attaching. So suddenly you can't fully extend the finger or can't properly bend the finger the way it normally does. Bones provide the majority of the stability of the finger, and a force that's strong enough can cause a fracture to a bone. Fracture is another term for a broken bone. Thankfully, most jammed fingers cause mild ligament sprain. Most of those are treated conservatively. Those can be splinted, though generally we don't recommend that they are splinted for too long because that can cause a lot of stiffness to the finger. One simple way to get these joints moving quickly is to what we call buddy taping, where we tape one finger to the other. That can provide some stability to the injured finger, but also can help move the joints of that finger, the uninjured finger helping to move the one that hurts. What we don't want to happen is for a mild ligament injury to turn into a stiff finger that can be difficult to treat later. So when you have a jammed finger, you want to look at, is there any deformity? Is it bent? Is there a large bulge that shouldn't be there? Is there swelling? How much swelling is there? Check your finger and try to, force it to extend all the way and flex all the way and see if you're missing any motion that should be there. If you're not able to fully straighten it, or if you're not able to really flex it in a relatively normal way, then that should give you some clues that something may be off. There are some injuries that, if not treated properly, can lead to permanent deformity. If there's deformity or loss of motion, the earlier a hand surgeon sees you, the better they'll be able to help you. And we can generally figure out what's going on pretty quickly with an exam or a simple x-ray.